Well, I'm not very good at taking no for an answer, and I like
Hey,
and I like connecting people to solve problems. I think a lot of problem solving in healthcare leadership is making sure that the right people are talking.
welcome to Success and Chaos, a healthcare podcast where each episode is dedicated to driving success amidst the constant change and uncertainty. My name is Angela Adams, the CEO at Inflow Health.
And I'm Candice Garcia, CEO of Tungsten QI Partners and Director of the ACR Learning Network.
We are so excited to have our guest today, Josh Gregoire, a nurse, a change agent, a quality leader. He runs quality and population health for an ACO managing almost 90,000 lives at Valley Health System in New Jersey. Josh has a track record of building programs that the system, frankly, wasn't ready to fund. From food as medicine to LGBTQ primary care, by finding creative paths and bringing the right people along. Josh, welcome to Success and Chaos.
Thanks for having me.
Absolutely. I've been really excited about this since we learned about all of your great success that you've been driving in healthcare. Let's start back. You started in cardiothoracic surgery, as did I, which I love. You went into case management. You moved into population health and quality. What's the through line? What experiences shaped how you lead today? And how did that transition kind of make who you are today?
Yeah, so I mean, I think starting out as a bedside nurse and getting that clinical experience, I started to see that there was potential for me to impact my patients' outcomes in a different way. And so I became a case manager, and I found it really interesting because my responsibility it was beyond the four walls of the hospital. So I had to be thinking about not just what was going to happen for patients under my care today, but how were they going to get home safely? How were they going to have what they needed so that they weren't coming back to us and being rehospitalized unnecessarily? And I remember this one story when I was a case manager. I had a patient that needed to go home on Lovenox. We were trying to get the patient out the door safely, and there were a lot of issues with them being able to fill their medication, getting insurance coverage, being able to afford the medication. And so they were ready to go. Their ride was there to pick them up, and I wanted them to get home safely. But I needed to make sure that they were able to have what they needed to start their medication at home. So I remember going to my director at the time and asking her if I can get this medication covered, through our patient assistance funds and can get this to the patient, would you be okay with me bringing this to the patient's house? And the patient lived in New York City, so I actually ended up taking a taxi cab to deliver the Lovenox medication to the patient's home. But I was able to get them home safely and make sure they had what they needed. And I knew that was going to make the difference for the patient. And I'll never forget, my boss had told me, you got to do whatever you got to do to help this patient. And it was a really different mindset than we're accustomed to in healthcare, where we tend to be very structured and have very specific rules. And this was thinking more globally from a population health mindset and saying, what is it that this patient needs and how can we help them?
Man, I love that. See a problem, solve a problem. You definitely live that as a mantra. I can tell that. I would say that each one of us on this call probably faced multiple of those examples throughout nursing. And it's crazy to me that the nurse who's left at the bedside doing a million things is the one also left thinking, if this patient doesn't get this thing and I don't take this to their house, I mean, it's just like overwhelming everything that falls on the nurse's plate. But that was above and beyond for sure.
Yeah, I like to see though the professional problem solving that we see here, the ability to understand what the challenge is and to meet it with such a creative solution. Like that is very organization specific. It sounds like you had an environment that your leader created where you were able to think outside the box and not be afraid to ask for permission, even if it seemed like, hey, this is not something that we do. This is not this is not how we provide care. You were able to actually, it sounds like you were inspired to think outside of that framework and do something new and different. And they let you.
Yeah, I think it was fueled by the emergence of the bundled payment initiatives in our cardiac patient program. And we were really starting to think differently about, you hear the classic example of, the patient with COPD that's revolving door coming back to the emergency department when what they really need isn't more medication, but maybe an air conditioner so that they can have a cooler apartment and have, cleaner air that they're breathing in the hot summer months. And if we were just to spend this money on an air conditioner instead, we could save so much and, really actually address the root cause of what this patient's issue is. And I think, some of that thinking starts to infuse into healthcare in different ways when we have these alternative payment models that are really driving innovation.
Yeah, you know what? It makes me think about, problem solving is like creativity and it's yes, but it's also within the constraints of your environment. And I think that what's so interesting about the path that you've been on and the work that you've done is that you really started to tackle the constraints of funding for these programs that are root causes for your patients and that are going to be push the way that push medicine the way that we care for patients in a way that actually will meet them where they're at and provide the care that they need. Can you tell us a little bit about your food as medicine program for diabetic patients and how you funded that and how you got this to be part of the care pathway for the patients?
Absolutely. So, working in a value-based model, we have contracts for about 90,000 patient lives through value-based care, which means that there's a component of fee-for-service, just like usual, but there's also a component of value-based incentives that you can get on the back end if you're able to reduce the cost of care while also maintaining quality. So that's where the
Mm,
innovation starts to come in. How can we improve our patients' quality outcomes but also make sure that they're utilizing the right care at the right time, the right place. And so we had a group of patients in our diabetes center who were really facing what we call clinical inertia. They're reaching that point where they feel like, I've tried the medications, I've attempted the diet, I've done everything that my doctors are telling me to do, and I'm still not seeing the outcomes that I need to see. And, maybe I'm just not somebody that's going to get better. And it's really deflating for patients to reach that point, but it's actually quite common. And so we had learned about, ways that you could start to address clinical inertia and help to get patients over the hump using food. And I'd heard a really innovative program at Geisinger where they did a food as medicine initiative, and they were delivering food to patients in the diabetes program, and measuring their A1Cs, measuring certain outcomes to see how they could improve. And they saw a lot of success. Well, I am not really the expert in food management and delivery. I'm a nurse. I focus on the clinical piece. So I was able to find an organization that can provide food as medicine, nutritious meals ready to eat, as well as nutritionist support. And
mm.
what I thought was that it would be a really great supplement to our program, but we reached the classic example where things that really work for patients aren't things that are reimbursed or, funded by traditional insurance models. And so um, we have a really great community here at Valley, and we have a number of different resources that we can go to and ask for help for financial assistance to fund projects and demonstrate outcomes in certain patient populations. So I said, well, what if we were able to get a gift that could support this program as a proof of concept to show the impact of using medically tailored meals and nutritionist support on patient outcomes in the diabetic patient population?
That is some forward thinking right now. I go to all these conferences and we sit there and they talk about, I don't know how to get all these programs funded. I don't know what to do. And you just like took the bull by the horns, went out there to the community, which I love because honestly, I also live in a community that if I go to some of the community leaders and say, hey, we really need this, they find the funding for it somehow, some way. So I love that you took that initiative. Also, change agent behavior right there. So what was some of the impacts that you guys saw from the food as medicine program? Did you guys have successful outcomes?
We did. It was a small sample, but we were able to demonstrate meaningful A1C reductions in the patient population. We know that for every 1 point A1C reduction, it correlates to about a $1,200 per member per year savings in diabetic patients. And so we essentially covered the cost of our program with the impact that we were having. But I think what was most impactful was the patient engagement. So once we started getting
Mm.
people bought in with the meals and the nutritionist support, once they started to see that they were making progress, they started to believe that they could manage and handle more. And so that's where we used our population health approach, having our nurses who had established relationships with them start to engage them in additional gap closure. So for example, we know diabetes affects the eyes, and patients with diabetes really need an annual diabetic eye exam or a retinal photo. So we were able to get them to come into our center to sit in front of our retinal camera and get the photo taken. And so, they started to feel like I could do one more thing and I could take a look at another thing that could help me get a better outcome. And this was really important because we know that retinal disease tends to be silent. You may have something brewing until you start to lose your vision. You don't know that it's a problem. So we were able to identify a significant amount of eye disease in this patient population, and patients were not aware. So this was something where we were able to close additional quality gaps because we helped patients to see that they could do this and they could manage their care differently.
That's amazing. What a great success story. So in our conversation, you told us this amazing story of you were having a conversation on a playground one day, and it led you to build another phenomenal program. Talk to us about how a conversation on the playground led you to build an LGBTQ primary care.
So it was during COVID, during not the peak of COVID, but a little bit after, and I was at a gay dads meetup, and our kids were playing on the playground, and I was talking to this one person, and he was saying, we were talking about the grind of work, and he said, I just wish I could do something different. My job is so stressful. I just wish I could do something more meaningful. And I said, well, what do you do? And he said, I'm an infectious disease doctor. And I said, well, yeah, I can really understand the type of pressure that you're under. And I said, well, what would you want to do? How would you want to pivot your career? And he said, well, I spent some time working in the LGBTQ clinic and providing care to LGBTQ patients, and it's really rewarding, it's really fulfilling, and I just wish I could do it full time. And I said, well, why don't you? And he said, where am I going to do that? And I said, well, why don't you come to Valley? And we didn't have an LGBTQ program at the time for primary care. And I was just an active member of our LGBTQ steering committee and sort of a leader that supported our committee's, growth and progress. And with no authority to do so whatsoever, I attempted to recruit a physician. I knew the right people. I went to our senior vice president and I said, listen, we've got this really amazing doctor. We've been trying to, impact our LGBTQ care differently. And, I know it's really hard to ask for an FTE, to ask for a new position, especially a physician. And I said, we've got this primary care program and they're recruiting for new physicians. What if we approach this as a primary care physician that specializes in LGBTQ health? And the rest is sort of history. I got the right people together, they hit it off. And, now we really have a thriving, comprehensive primary care center for LGBTQ care.
That is so amazing. I love how there's not many people that take an initiative on a conversation, go behind the scenes, and get all of those things done. I mean, I think that is very commendable because I would say most people would leave that conversation and be like, wouldn't it be cool if we had that thing? And like, what a great conversation I just had. But you taking that action, what do you think drives that in you? What do you think led to that in life? Because I think it's a characteristic that a lot of us look for when we're hiring our teams. But like, what do you think developed it in you?
Well, I'm not very good at taking no for an answer, and I like
Hey,
and I like connecting people to solve problems. I think a lot of problem solving in healthcare leadership is making sure that the right people are talking. And, we can
Yeah.
frame the issue, we can present the facts, but we really have to get people working together and talking to each other. And I think a lot of times, when we have problems that we're facing, we're just not getting the right people together, getting the right people to understand the issues and to hear each other and their perspectives. And so, a lot of what I do in my success is just making sure that people are communicating. And I think that's an example of what I did. And I think also, um, you know, a lot of the success of programs like this is it has to come from the people within an organization and the people that are closest to the patients and the work. And our
Mm.
steering committee had been talking about, some of the gaps that they saw for some time. So I was able to go back to them and share, like, because of your voice, because of your advocacy, we were able to identify this gap, get this physician in the door, open this center. And I think it makes it more personal, and it makes it something that belongs to people. And I think that's the type of support that you need for programs like this to thrive.
I
Well,
love
it's
that.
kind of like where vision meets innovation meets skill. It's like you have kind of the perfect combination to push the boundaries of how we provide care and how you lead your teams. It's just you said kind of like the foundational change management skills, and really leadership. When we teach leadership in the program that I run, it really is the best leaders are the best at knowing who to talk to, how to frame it, and how to get how to meet everybody where they're at to bring them towards a common goal to move forward. And it sounds like this is where you are an expert in leadership. When you have that combination of understanding and ability, there really is nothing that you can't do as a leader. Tell me, can you tell me a little bit about your team and you work with? Are you a one man show? I know you talked a little bit about the frontline staff and them participating, but how do you kind of lead a team to do what you do?
Yeah, so I mean, quality and patient safety is never going to be a department where you're going to have a significant amount of people. And a lot of my accomplishments as a leader throughout my career have been managing by influence. And I think managing by influence is really challenging because you have to get people to want to do things, you have to get people to believe in something, right? And so that's a lot of what I do is, I do have a team, a phenomenal team, but they're doing the same work that I am in that they can't be out there solving every problem for every person. They need to be, how can I create this urgency in the teams that I work with to recognize and address things? How can I get people closest to the problem to think about what the best solution is? And how can I listen to them? I think a lot of times in leadership, one of our failures is thinking that we have it all figured out and trying to solve problems for people instead of bringing people together to identify what the barriers are and what some innovative or new ways that we could solve this problem might be. And so I think when you use that approach, it's a process improvement methodology where you're going to the sharp end, you're engaging the people closest to the problem, and you're asking them, what is the thing that would make this faster, more simple, and make doing the right thing the path of least resistance? When you
Mhm.
can engage them in that work and get them thinking about how to do it, what you do is you create an army of problem solvers. And as leaders, that's our goal.
I love it.
Yes. Have you ever read the book Multipliers? Oh, it's great. Liz Wiseman. It's about how people do this, how they become these kind of leaders. And she talks about like accidental diminishers, like we're all trying to do the right thing, but you're really hitting on a lot of the qualities of not only just taking your talent, but multiplying that around you. And actually, something we've been talking a lot about is multiplying organizations. How do you create an environment where like the multiplying behavior is the easiest behavior? And it really does sound like that is the kind of leader that you are. Yeah, look into this book. I think you'll love it. It'll just like touch on so many, gives so much language to the work that you're already doing and the way that you're leading.
And I wanted to touch on one thing you said, because I think early in leadership, everyone goes through the moment where they think that they need to have all of the answers. And they think that is what makes a good leader, is that I need to have all the answers. And it kind of is a slow trickle evolution in leadership for you to realize, oh, you know what? You might have some of the answers in your head, but saying those is going to diminish the quality of the team coming to that and the team coming together to solve that challenge. And then them taking that ownership, like you said. So I think maturity in leadership is knowing when to let the team come forward, when to listen, when to motivate somebody else and lift somebody else up. And so you show a lot of maturity. I'm sure it's because all of these great programs that you've run and gotten success from. I think there's one more that you talked about that I would love to learn more about. You expanded into maternal health with an IRB approved study. Tell us a little bit about that and what that passion project was about.
So, building on the success of our diabetes food pharmacy initiative, we were able to leverage those outcomes and go back to some of the payers that we work with to try to see if we could get additional funding. While we weren't successful, we knew that we had data, we had a story, and we had something that could help us to focus on a new patient population where we might be able to get more buy in. And so we were talking about the Black maternal health crisis and how Black birthing people have different outcomes in their pregnancy because of so many different factors in our healthcare system. And so, what we did is we tailored a food as medicine program to focus on patients in pregnancy with hypertension, diabetes, or obesity. And so we created a proposal using some of our past outcomes and identifying what program would impact this population and how we could leverage different tools like medically tailored meals and nutritionist support. And once again, we went to our foundation and we said, we're looking to find a donor that's interested in these types of projects. And this is what we're proposing. And very quickly, somebody latched on to this concept and offered us a considerable amount of money to go and do the work that we needed to do. And so we were able to develop an IRB approved study, a randomized control trial, enrolling 84 patients in a food as medicine initiative. And we're just completing our last patient in our study and I'm really optimistic about what the data is going to show and how we can really take this to take the next step to get more support. So I think it's really discouraging sometimes to be told no, but I think we can oftentimes use these things as steps in our process to continue to make an impact. And that's really how we're looking at this.
Payers said no to funding something? That's so shocking. Not shocking for anybody here. That is amazing. I'm so excited to hear the results of that program and how that goes. I wish I could, to Candace's point, multiply you across every health system in America because we need more of this innovation, thinking about problems, thinking about the root cause. And I feel like healthcare has gotten stuck thinking about things in a box. And that is not how people live. They live outside of the box. And that is where the problems exist. And many, many times, until we solve that, we're really not going to solve the core of what our patients need and the health outcome that we're trying to impact. Um, Candace, do you have any closing questions for Josh?
Yeah, well, I think that with so much leadership wisdom in there, if we had, let's say you're coaching your best friend's son or daughter, and they ask you what is the most important skill that they can work on to be a successful leader in the next decade, what do you tell them?
You're going to laugh, but I heard Shonda Rhimes giving a graduation speech, and somebody asked her how she does it all as a mother and as a working person, how she manages to do everything so successfully. And her response was, I don't. If I'm doing something well in one part of my life, I'm probably failing in another part of my life. And I think that message as a high functioning person and an overachiever, I think that message really resonates with me as a leader. As leaders, we can't just accept failing at something. You know, we can't say I'm going to focus on this one thing and I'm going to fail at all these other things. But I think when we wake up each day, we can choose to nurture the right things. And I think it's am I nurturing the right projects today? I have a lot of balls in the air. I'm going to be doing a lot of different things. I'm going to maybe work on this one thing and then come back to it. But today, what is my greatest impact that I can make? And what is the thing that I need to be focusing on? And I think that's what I try to do each day. I have an endless to do list. It's never going to get done. The work will always be there. But I think our job as leaders is, are we doing the right thing? Are we nurturing the right project? Are we connecting with people? Today's mission might just be to listen, to connect, and to engage with our teams. And that's what's going to create the lasting impact. We'll always be able to come back to the checklist and the projects. But I think that's my greatest advice is just think about what you're putting your effort and your energy into today. Make sure it's the right thing and just know that those other things will always still be there.
That's phenomenal. That's really great advice. I think that had you not spent so much time of your career building relationships, you probably wouldn't be as successful of getting everybody around you to believe in something and believe in like, hey, this is something we need to impact. So I can tell you're spending your time in the right place.
Well, thank you all so much. Thank you, Josh, for being here. It was such a pleasure speaking with you today.
Thank you so much. I had a great time.
And thank you, audience, for joining us on Success and Chaos. Be sure to like, follow, and share today's episode on Spotify, Apple Podcasts, YouTube, or wherever you get your podcasts. And a special thank you to the Inflow Health team for their production support.